Welcome to Accident Stories. I'm your host, Dr. Steve Eggleston. Today I want to tell you a story about a client of mine who was in a car accident and had long-term residual problems after the car accident because she did not get her concussion treated properly. If you will, this is Concussion After a Car Accident, Part 2. There was research done by a Dr. Lasson at the Montreal Canadiens hockey team, and her research showed that brain damage lasts for decades after the symptoms of the concussion appear to have resolved. So if you have had a concussion in a car accident, a truck accident, a motorcycle accident, and your symptoms are already gone, consider yourself lucky, but don't assume that your brain is back to normal yet. You may still end up with long-term problems. You may be diagnosed with some psychosis 5 or 10 years from now. You may end up with sleep apnea or any of the other dozens of long-term problems and eventual problems that you will have following a concussion. Psychosis is one that you should worry about a lot. A study published in 2002 in the American Journal of Psychiatry reported a 30-year concussion study. They took people who had had a concussion and followed them for 30 years to see what other problems they had in their lives. Here's what they found. 26.7% had major depression. Now, since we consider moderate depression to be sometimes suicidal, major depression is really, really serious. If you've had a concussion, please get it treated. 11.7% had alcohol abuse or dependency issues. They had become alcoholics. 8.3% had been diagnosed with a panic disorder. 8.3% had been diagnosed with some specific phobia like agoraphobia, acrophobia, or arachibutyrophobia, or a fear of the number 13 like triskaidekaphobia. There's all kinds of weird phobias that can occur. 6.7% had psychotic disorders. 23.7% had been diagnosed with a personality disorder. 15% avoidant personality disorder, 8.3% paranoid personality disorder, and 6.7% schizoid personality disorder. Now, this is above and beyond the normal number of these diseases that were diagnosed in people who had not had concussions. So these are pretty serious and long-lasting. I want to tell you that if you are over 50 and you've been involved in an accident, you need to get checked for concussion, and you may need more help than if you're under 50. The brains of older people, as we could probably assume, are not as young and youthful and healthy as the brains in younger people, and so they need more treatment, more care, and they take longer to recover. They need aggressive rehabilitation following concussion. I have a personal belief that many Alzheimer's patients are simply concussions that were never diagnosed, and they get worse for a few years, and then voila, you get diagnosed with Alzheimer's. The tests that doctors use to test you for Alzheimer's and for concussion, it's exactly the same test, folks. I think I'm right on this one. In any case, if you have a concussion and you're having any of the symptoms that I talked about in part 1 of concussions after a car accident, get some help. Now, children who have concussions are a little bit different. Children between the ages of 3 and 14, they have psychotic symptoms in the second year following a concussion, if they're going to have them, of course. Now, adults tend to have them 5 or more years after the concussion, whereas children seem to manifest the psychiatric illnesses after just 1 year, in the second year. Now, the early signs for children with concussions include wetting the bed and acting out or disruptive behaviors. So if you have a child who you suspect may have had a concussion and they're 7 years old and they stopped wetting the bed years ago, and now suddenly they can't control their bladder anymore, they're wetting the bed again, get them checked for concussion. Now, if it turns out they don't have a concussion, get them checked for any myelopathy or pressure or damage in their neck spinal cord, because that can also cause a loss of bowel or bladder control in adults or children. Acting out behaviors include being disruptive in class, your grades tend to go down, it takes longer to study, you can't remember things that you're supposed to learn, your memory's not functioning well because you're not sleeping well, and all these cascade into a world of problems for these young people. There is a direct correlation between concussions and sleep apnea. Research shows that concussion and obstructive sleep apnea go hand in hand, and there is a causal relationship that is stronger than ever in the scientific literature. Scientists say that blunt head trauma is a higher risk for obstructive sleep apnea than invasive head trauma. Now, blunt head trauma means you've had a concussion or been hit in the head or your head was shaken, but your skull was not fractured, as happens with invasive head trauma. Crimes and concussions can go hand in hand. I know of an attorney in Florida who's been working with inmates in prisons who've committed terrible felonies and found out that if they go back in their history, they actually had concussions when they were young. That led to psychosis, psychotic behavior, and that led to a life of crime. There is substantial medical evidence that concussion can lead to a life of crime. You are really, really helping yourself, and doctors are helping your patients when you diagnose a concussion and refer them to a specialist. Head injuries occur in about 5% of the population every year, and symptoms of concussion include problems with post-traumatic vertigo. These can include balance problems where you suddenly fall to one side, vertigo, which is a sensation of spinning or whirling. You're unsure of your footsteps. You might be going downstairs and you're having difficulty because you can't feel the steps or you're not feeling too sure of yourself. Some patients have reported to me, and clients, now that I'm a lawyer, have reported that they're bumping into things like door jambs or walls or the coffee table. They keep bruising their leg because they keep bumping into the coffee table. And this didn't happen before the accident. This didn't happen before they had a concussion from the accident. So it's from the accident. You need to get it diagnosed. You need to get it treated. Now, of all the symptoms that there are of concussion, these three are the most important: anxiety, noise sensitivity, and trouble thinking. When all three of these are present after a brain concussion, it's a bad sign, I hate to tell you. And if you have all three of these, you have my empathy, because this indicates that your recovery is going to take a long time. When these three are present, you can expect that it's going to take months or years to recover, and you need to be vigilant about trying to get well. Some people, they just kind of go, I'm going to feel okay. They think they're going to get better. That is not the right approach to a concussion, and certainly in a personal injury situation, it's definitely not the right approach. You will possibly have concussion symptoms for years and years. You have a 4 to 9% chance of being diagnosed as literally psychotic sometime in your life, and you didn't get compensated for any of this. So get checked, figure it out, get treatment. You only have one chance to get well before your personal injury case gets settled. So make sure your doctors know what's going on with you. Be clear with them. Now, this has been Accident Stories, Concussions, Part 2. I'm your host, Dr. Steve Eggleston. I treated patients in my chiropractic office in California for 20 years. Then in 2007, I became a lawyer and have handled exclusively personal injury cases ever since. I've handled thousands and thousands of personal injury cases. I've written checks for millions and millions of dollars to my clients over the years. If you or a loved one has been in an accident in the state of California and would like to speak to me personally about helping you as your attorney in handling your case, feel free to call me toll free at 877-424-4765. That spells 877-4-CHIRO-LAW. If you ask to speak to me, Dr. Eggleston, personally, I will be happy to pick up the phone and discuss your symptoms and representing you. Now, if you have been in an accident in another state, there's no need to call me. You can just talk to your doctors in your local area. Use the information you've learned from accident stories so that you can explain your symptoms and speak intelligently to your doctors. Talk to your attorney and use the information from accident stories when you speak to your attorney as well. If you would like to hear more accident stories about neck pain, whiplash, PTSD, shoulder injuries, elbow injuries, or dozens and dozens of other injuries that come from car accidents, subscribe to the channel so it's easier to find. Just hit the subscribe button below. If you like what you've heard today and it's helped you in some way, hit the like button. If you hit the bell icon next to the subscribe button, you will also get notified every time I upload a new Accident Stories broadcast. And that can help you with other symptoms and help you to get well also. Thanks for listening to Accident Stories. I'm your host, Dr. Steve Eggleston. I wish you good health, a speedy recovery, and a successful outcome of your case.